Most men over 60 in the United States know that prostate health becomes a major concern as the years go by. Yet many underestimate how daily lifestyle choices can either protect or quietly harm this small but vital gland. And as a urologist would explain, the truth is that 3 simple daily habits can make an enormous difference in whether you continue enjoying strong urinary flow, good sexual vitality, and peace of mind regarding prostate cancer risk. And the first of these habits is learning how to stay hydrated in the right way, because water is not just about quenching thirst, but about flushing toxins, reducing urinary tract irritation, and preventing the concentration of minerals that can contribute to prostate discomfort or kidney issues. So for men in America who grew up drinking soda, coffee, or beer more than pure water, this shift may feel small, but it is powerful. And hydration must be steady throughout the day, instead of gulping large amounts at once, since that can overload the bladder and worsen nighttime urination, a problem known as nocturia that robs many older men of quality sleep. So the key is sipping clean water regularly, aiming for about 8 glasses spread evenly, while cutting back on caffeinated sodas, excess coffee, and alcohol, which act as diuretics and bladder irritants. And many American men also do not realize that sugary drinks not only damage weight and metabolism, but also fuel inflammation that can make the prostate more sensitive. So by replacing even half of those daily sodas or sweet teas with plain water, flavored seltzer, or herbal tea, you reduce inflammation, improve circulation, and directly support prostate comfort. And hydration has another hidden benefit for men over 60, which is improving erectile and sexual health, since blood is about 90% water and proper hydration keeps circulation smooth, which indirectly protects prostate tissue by ensuring healthy oxygen and nutrient delivery. And many urologists now emphasize that it is not just about how much you drink, but when you drink, recommending that men over 60 stop heavy drinking of fluids 2 hours before bed to reduce nighttime bathroom trips, while maintaining steady hydration during daylight to help the kidneys and bladder flush irritants in a balanced way. And this habit, though simple, can dramatically improve energy, urinary comfort, and overall prostate function over time, especially when combined with the second crucial habit, eating a prostate-friendly diet that reduces inflammation, balances hormones, and nourishes the body with protective compounds. When it comes to diet, American men over 60 are in a unique position because many grew up in a food culture dominated by red meat, fried foods, and processed snacks. Yet research now clearly shows that diets rich in vegetables, fruits, and healthy fats are protective for the prostate. And urologists often highlight specific foods like tomatoes, which are high in lycopene, a powerful antioxidant shown in studies to lower prostate cancer risk. So incorporating tomato sauce, cooked tomatoes, or even tomato juice into meals is a simple but evidence-based step. While cruciferous vegetables like broccoli, cauliflower, and kale contain compounds such as sulforaphane that support the liver's detox pathways and may reduce the growth of abnormal prostate cells. And fatty fish like salmon, sardines, and mackerel provide omega-3 fatty acids, which are anti-inflammatory and support cardiovascular as well as prostate health, making 2 servings per week an excellent target. And nuts like walnuts, almonds, and Brazil nuts are packed with minerals like selenium and zinc that are essential for hormone balance and prostate integrity, while berries and green tea offer antioxidants that combat oxidative stress, which accelerates cellular aging in the prostate. So the picture becomes clear. By choosing whole, nutrient-rich foods daily, older men can drastically reduce their risk of benign prostatic hyperplasia, BPH, and even prostate cancer, while improving urinary comfort and sexual vitality. Yet it is not only about what to add, but also what to reduce. And this is where many American habits need adjustment, because processed meats like bacon, hot dogs, and deli slices are linked to higher cancer risk. Fried foods and fast food meals increase systemic inflammation, and excessive dairy may worsen hormone imbalances that fuel prostate growth. So moderation is key. And men over 60 should aim to replace red meat-heavy meals with lean poultry, fish, or plant proteins more often, while reducing cheese and butter in favor of olive oil and avocado, which are staples of the Mediterranean diet, a style of eating repeatedly shown in studies to reduce chronic disease risk, including prostate issues and beyond food choices. Portion control and weight management matter deeply, since abdominal obesity increases estrogen levels and inflammation, both of which put stress on the prostate. So daily habit number 2 becomes not just eating healthy foods, but intentionally building a pattern of meals that supply antioxidants, healthy fats, and anti-inflammatory nutrients while cutting out the prostate-aggravating culprits of the modern American diet. And this sets the stage for the third crucial habit, which is staying physically active every single day, not necessarily through intense gym workouts, but through consistent, moderate movement that supports circulation, hormone balance, and stress control, all of which directly impact prostate function. Physical activity after 60 may look different than in earlier decades, yet it remains essential. And a urologist would emphasize that sedentary living is one of the most damaging patterns for the prostate, because sitting for long stretches compresses pelvic tissues, slows circulation, and increases inflammation. So daily walking, cycling, swimming, or even yoga can make a tremendous difference. And research has shown that men who exercise regularly have a significantly lower risk of developing aggressive prostate cancer, partly because physical activity lowers insulin resistance and keeps testosterone metabolism in a healthy range, preventing hormonal imbalances that can stimulate abnormal prostate growth. And another overlooked benefit of exercise is stress reduction, since chronic stress elevates cortisol, which fuels inflammation and immune dysfunction, creating a fertile ground for prostate problems. So activities like Tai Chi, stretching, or light strength training not only strengthen the body but also calm the mind. And for American men over 60, many of whom may already be dealing with arthritis, heart disease, or diabetes, even low-impact activities such as brisk walking in the neighborhood, gardening, or water aerobics can be powerful. And consistency matters far more than intensity. So aiming for at least 30 minutes of movement daily is a realistic and prostate-protective goal. And exercise also ties back into sexual health because stronger circulation improves erectile function and confidence, which in turn lowers stress and improves quality of life, making daily movement a cornerstone habit. And when combined with smart hydration and a prostate-friendly diet, it forms a simple but scientifically grounded trifecta of habits that can transform prostate health for men in their 60s and beyond. For men over 60 in the United States, prostate health is not just a medical issue, but a quality of life issue. And urologists across the country constantly emphasize that the choices you make every single day will either protect this walnut-sized gland or put you at higher risk for enlargement, urinary problems, and even prostate cancer, which remains one of the most common cancers among American men. Yet the hopeful truth is that there are very specific habits, simple, practical steps you can practice daily, that can dramatically lower your risk, ease your symptoms, and help you maintain independence, confidence, and vitality into your 60s, 70s, and even 80s. And when patients sit down in a urologist's office, the advice often centers around 3 powerful daily habits: drinking water the right way, eating a prostate-friendly diet, and staying physically active. But what most men don't realize is that these habits go much deeper than generic advice. They affect the delicate balance of hormones, inflammation, and circulation that control prostate health. And they are often the difference between a man who struggles with frequent nighttime urination, fatigue, and declining sexual function, and a man who feels comfortable, sleeps well, and stays energetic. So let's take a closer look at how these habits work and why they matter so much after the age of 60. Hydration is the first and most overlooked tool in protecting your prostate. And while most men assume that just drink 8 glasses a day is enough, the truth is more nuanced. Because it is not only the quantity of water that matters, but also the timing, the type of fluids consumed, and the balance between hydration and bladder comfort. So in the United States, where coffee, soda, and alcohol are cultural staples, men over 60 often unknowingly sabotage their prostate by overloading on irritant beverages while skimping on plain water. And this leads to concentrated urine, bladder irritation, and more frequent nighttime bathroom trips, which then disturb sleep and weaken the immune system. So a urologist would explain that the smart way to hydrate is to spread water intake evenly throughout the day, sip slowly rather than gulping, and taper off in the evening to reduce nocturia, aiming to keep the urine pale yellow instead of dark, which is a visual cue of hydration balance. And men should also be aware that certain minerals matter. Magnesium and potassium-rich water support smooth muscle function in the bladder, while reducing sodium intake helps lower blood pressure and prevents fluid retention, both of which ease strain on the urinary tract. And for men used to drinking soda or sweetened iced tea with meals, replacing even half of those drinks with plain or sparkling water can significantly cut down on sugar-induced inflammation, which has been linked to higher prostate cancer risk. And another hydration tip involves limiting alcohol, especially beer, since it not only irritates the bladder, but also raises estrogen levels and can worsen benign prostatic hyperplasia, BPH, a common condition in aging men. So practicing mindful hydration is not about drinking excessive amounts, but about choosing clean water as your main beverage, adding herbal teas like chamomile or hibiscus for variety, and setting an intentional routine where hydration supports prostate comfort instead of working against it. The second habit, eating a prostate-friendly diet, is arguably the most powerful lifestyle intervention for men over 60, because the foods you eat daily either reduce or increase the inflammatory processes that drive prostate enlargement and cancer growth. And American diets tend to be heavy in red meat, processed foods, fried items, and excess dairy, all of which create a hormonal and metabolic environment that strains the prostate. So shifting toward a more Mediterranean-style eating pattern is strongly advised by urologists and nutrition researchers alike. And this doesn't mean giving up taste or variety, but rather rebalancing the plate to include more vegetables, fruits, legumes, whole grains, fish, and healthy fats while reducing the reliance on processed meats, fries, and sugary desserts. So men can still enjoy hearty meals, but with prostate protection in mind. And specific foods play a special role. Tomatoes, rich in lycopene, help prevent DNA damage in prostate cells. Cruciferous vegetables like broccoli, Brussels sprouts, and kale contain compounds that support detoxification and may reduce the growth of prostate tumors. Green tea provides catechins that fight oxidative stress. And fish like salmon or sardines supply omega-3s that reduce systemic inflammation, while nuts and seeds supply zinc and selenium, minerals essential for prostate and testosterone health. So including a handful of walnuts, pumpkin seeds, or Brazil nuts daily is a smart habit, and even spices like turmeric and garlic provide anti-inflammatory benefits, making them simple additions to American cooking routines. Yet it is equally important to reduce dietary risks, cutting down on processed red meats like bacon and hot dogs, limiting fried fast food meals, and reducing excessive dairy intake since high dairy consumption has been linked in studies to higher prostate cancer risk. So moderation in cheese, milk, and butter is key. And instead, men should replace these with olive oil, avocado, and plant-based alternatives. And portion control is another factor since overeating, especially high-calorie processed foods, leads to obesity, which increases estrogen dominance and systemic inflammation, both harmful to prostate health. So a balanced, plant-forward diet not only supports the prostate, but also lowers heart disease, diabetes, and dementia risks, creating a lifestyle pattern that pays dividends across the board for men over 60. The third habit, daily movement, is where many older men fall short because after retirement, the natural activity levels decline, yet sitting too much is one of the worst things for prostate and overall health. And studies have repeatedly shown that regular physical activity lowers the risk of aggressive prostate cancer, improves urinary symptoms, and supports sexual function, all while enhancing mood and energy. So exercise is not optional, but essential. And the good news is that it does not have to be extreme or painful. Walking 30 minutes daily, swimming, cycling, or even gardening can all provide the needed benefits. And strength training twice per week helps preserve muscle mass and testosterone balance. While flexibility and stress-reducing exercises like yoga or Tai Chi lower cortisol, the stress hormone that fuels inflammation, and many American men in their 60s may struggle with joint pain or chronic conditions. Yet low-impact activities like water aerobics or resistance bands make it possible to move safely. So consistency matters far more than intensity. And the urologist's message is clear. Make movement a daily ritual, not an occasional effort, because circulation is the lifeblood of prostate health. And when blood flow is strong, oxygen and nutrients reach the prostate efficiently, inflammation is reduced, and urinary comfort improves. And this is especially important in preventing erectile dysfunction, which is linked not only to vascular health but also to prostate issues. So exercise in this sense serves both physical and emotional well-being, giving men confidence and quality of life.